Chicken parm, you taste so good.
Peyton Manning, one of the most well-known patients of stem cell tourism in the media. After many years of playing in the NFL and several neck injuries, Manning flew to Europe to receive stem cell treatment. This treatment involved injecting fat cells into Manning's neck, a procedure that is not approved in the United States.
Reports also suggest that Manning travelled to Europe recently for stem cell therapy unavailable in the US. The procedure involves taking stem cells from fat tissues in the abdomen and injecting them into the problem area. Stem cell experts suggest such therapy can help speed recovery in 3 ways: by reducing nerve inflammation, regenerating nerve cells, and stimulating bone growth and fusion.
With Manning's case, no adverse side effects were reported and he is still living healthy. However, for him, this was an orthopedic surgery, and many stem cell treatments aim to cure heart disease and neurological problems. While the basic idea for stem cell therapy is to rebuild with the stem cell's regenerative properties, how the stem cells react in the body is not well supported by researchers in the United States. In 2009, a study in the journal PLOS Medicine documented a case of an Israeli boy who went to Russia to have fetal stem cells injected into his spinal cord and brain. These stem cells developed into a brain tumor as a result of the treatment.
Other serious complications have been reported from overseas stem cell treatment. In Thailand, a woman treated with her own stem cells for kidney disease ended up developing tumors. After Ricky Chick was paralyzed from the waist down in a motorcycle accident, he became frustrated with the lack of options available in England, his home country. After traveling to Ecuador for private stem cell therapy, he came home reporting terrible headaches and fell into a coma. He died the next day. Germany's XL Center, formerly the largest stem cell clinic in Europe, was shut down after an otherwise healthy 18-month-old boy with cerebral palsy died from treatment.
There are many cases in which the effects of stem cell therapy have been well documented, such as its use for growing bone marrow. However, because of this success, it seems promising that stem cell therapy is safe and effective to use in other treatments. That is not the case. With not much research or data to back up the many therapies being carried out in foreign countries, many treatments being advertised by clinics are ineffective and can be very harmful.
These practices have a number of negative ramifications, ranging from unregulated practices to numerous deaths. A significant problem that is relevant in almost every treatment people seek is a lack of follow-up appointments to make sure that the healing process is going smoothly or there were no further complications with the procedure. It is usually just an initial appointment, and once you are done, you aren't able to go back. At an annual meeting held here in San Francisco, the International Society for Stem Cell Research had a Stanford University researcher and president of their society, Irvin Wiseman, speak about the problems of stem cell tourism. He claimed that the problem is large and growing, and that there are more than 200 practitioners or clinics making claims for stem cell cures, most of them being located in developing countries where regulatory oversight is weak. Dr. Weissman explained that it is the society's responsibility to say that these cures are not stem cell treatments, and that these clinics are offering unproven therapies and treating your wallet, not you. He left these meetings stating that stem cell tourism is an exploitation of the promise of stem cells.
For the person that has an untreatable illness, survival has a price, and it usually ranges from $10,000 to $90,000. It is not uncommon for those who have exhausted all remedies to resort to stem cell tourism. For people with cancer, ALS, and other diseases, stem cell tourism seems to be the only glimmer of hope for a better life. According to Al Tacharo, professor of bioethics and law in University of Wisconsin, desperate patients are easy targets for unscrupulous clinics that are offering untested and risky stem cell treatments. The evidences of these therapies are limited except for bone marrow cells, but patients all around the world are convinced that stem cells are the ultimate cure. The cost varies widely from location, healthcare provider, facility, and other factors that are necessary for the complex procedure.
Hope you have found this video interesting. The main messages to take home are, when you think of stem cell tourism, remember that it's the practice of unproven stem cell therapies for a wide range of diseases and disabilities. Majority of stem cell therapies are not tightly regulated. They fall short of ethical or professional standards, which include consistent starting materials, tests in animal models, review of protocols, and most important, informed consent from patients. Stem cell tourism is simply fraud. Some clinics who participate in this research are run by frauds. people that are lying for profit, and these lies are hurting many people all over the world. Stem cell tourism may bring hope to people with incurable diseases, and hope may very well be what will continue to drive people to seek these treatments. If you are or end up being one of these hopeful individuals, always be cautious to what you're getting into. Maybe in the near future there will be less negativity towards stem cell based therapies, but for now there is much work ahead to be done.